Good day, ma'am. My name is Doreene Espiritu from 3BSNE, and today I will be demonstrating on how to self-inject an insulin. So first, this is to facilitate self-care and provide knowledge to the patient. The equipment that we need in this procedure is an alcohol, insulin medication, an insulin syringe, and alcohol swab. So first, of course, check the physician's order. This is to verify correct patient, correct medication or dosage, then correct orders. So then next, perform hand hygiene to deter the spread of microorganism. Then next is to identify patient and verify the 10 rights of medication of administration. This is to confirm patient's identity. Then next is to assemble equipment and teaching materials. And place orderly on a table within easy reach in a quiet and comfortable environment. Organization and easy access to materials facilitates organization of the process or the learning process. Next is to introduce self and verify the patient and explain what you are going to do. So, my name is Doreene Espiritu, ma'am, and I am your student nurse for today. And ma'am, pwede pong pakisabi yung name po ninyo. Okay po, ma'am. Thank you. And ma'am, ang gagawin po natin ngayon is i-demonstrate ko po sa inyo kung paano po yung pag-inject ng insulin ng kayo-kayo lang po. So, or sa English po, self-injection of insulin po. Okay lang po ba yun, ma'am? Okay po, ma'am. So, have patient wash hands. So, ma'am, ganito po tayo maghugas ng kamay, ha? So, palm to palm po. Back of the hand. And interlace. So, each finger po. Then, circular motion po. So, ganun po tayo maghugas ng kamay. Next is to have patient manipulate syringe and explain the parts that need to remain sterile and those that can be touched. This is to provide familiarity with the ports of the syringe to increases safe administration. So, ito po yung insulin syringe natin. To open this po, ito po yung pwede nating hawakan. Itong katawan po ng syringe natin, yan po yung may mga numbers. Ito po yung plunger. Pwede din po nating hawakan yan. Ito po yung ginagamit natin to push the medication inside the body. And yung area po na hindi po natin pwedeng hawakan ay yung needle po at saka yung nandito po. So, yun po yung sterile area, so dapat po hindi po natin hawakan. Yan. Then next, discuss the order dose of the medication. This is to facilitate administration of correct dosage. Ito po yung medication natin, ma'am. May mga numbers po siya dyan. And per ml po, yan po yung dosage. Patient check the label and the expiration date on the medication vial and compare the dose of ordered medication to the markings on the syringe. Avoids delivery of precipitated or expired medication. Ito po yung medication natin. You have to check for the expiration date. Dapat hindi po siya cloudy or anything. And if expired na po siya or if the medication is not in good condition, do not use po. So, if the medication is insulin, have the patient inspect the vial for clumping or color change and allow to warm to room temperature. So, ito po, ma'am. So, pag meron pong clumping, ang gagawin lang po natin is ganun lang po. Yan. To shake lang po gently. And then, this is to reduce tissue trauma upon injection po. For example, 30 units po yung hiningi ng doktor. Ito po yung 30. So, kailangan po natin, iabot po natin yung medication po natin dyan sa 30. So, demonstrate the steps necessary to draw up the medication. So, first is to wipe off the top of the vial with alcohol. Dyan po, yung top po, wipe off with alcohol. And then, pull the plunger back to the same number of units to be removed from the vial. This is to facilitate accurate medication withdrawal from the vial. For example po, yung hinihingi ng doktor is 20 units. So, pull the plunger sa 20 units to get the accurate amount. Next, push the plunger back into the vial. So, dyan po, sa gitna po natin tutusugin po para hindi po siya matigas. Then, pull the plunger back to the vial. And then, hold the vial and the syringe together and turn both upside down. Turn both upside down. Then, with the other hand, pull the plunger back to the number of units to be given, making sure the needle stays under the fluid level of the vial. Para po malagyan po natin ng tama yung ating syringe. Then, do not touch the inside of the plunger. So, 20 units. Then, check for the presence of air bubbles inside the syringe. If bubbles are seen, then re-inject the medication back into the syringe and slowly pull back to the correct dose. Repeat until bubbles are not seen. Then remove the syringe from the vial without touching and recap the needle. Show chart of injection sites and have patient find accessible sites on his or her own body. Allow assessments of patient's ability to recognize acceptable injection sites. So, ma'am, ito po yung mga injection sites natin. Meron po tayo dito sa upper outer arm or dito po sa may arm natin. Then, dito po sa may abdomen. Then, pwede din po sa buttocks and dito po sa ating upper outer thighs. So, mas accessible po sa inyo. Pag self-injection po, mas accessible po yung nasa abdomen side. Then, discuss importance of systematically rotating sites. Using all of the sites in one area before altering site location. Have the patients choose a site to the abdomen or thigh where demonstration is easily visible. So, for example po, meron po tayo ditong rotation chart po. Ito po yung para sa abdomen natin, ma'am. Ito po yung navel. So, itatapat po natin to sa navel natin. Ang mahalaga po doon, ma'am, is not to, for example po, nag-inject po kayo dito na area, dito po sa upper area natin, ngayong araw, then, pagkakinabukasan po, dito na naman po na area, or dito po na area, or dito po na area. Huwag nyo pong uulitin doon sa area, ma'am, to avoid lipohypertrophy po, ma'am. So, administer the injection concurrently, explaining each step in simple terms. Visualization and verbal explanation facilitate retention. Po, ma'am, ito po yung abdomen natin. And then, kung gagamit po tayo ng chart, for example, nandito po yung navel. Ayan po. Ayan. Tapos, kapag pipili po tayo ng site, for example, dito po na site, dito. So, ang kailangan lang po natin gawin, kung hindi po tayo gagamit itong chart, for example, dito po. So, dito, wipe the area to be injected by an alcohol. So, for example, this is the abdomen. So, wipe po natin ng alcohol. Then, it-out lang po natin yung area kung saan po tayo mag-inject. Then, remove then, hold it like a pencil. 30 to 60 degrees. Pag pagpayat po yung patient natin, pero pag matataba, pwede pong 90. So, try po natin ng like that. Tapos, then, bitawan po natin, then, insert, make sure to inject all the medication, and then remove guard. Discard po natin yung ating syringe. Then, have patient indication record chart where injection was given. So, ma'am, kanina po, nag-inject po tayo dito sa inyong, dito po sa ating left area. So, bukas naman po, dito po tayo sa ating right. So, give opportunity for patient to ask question regarding procedure. Is to provide guidelines to patient with written literature and visual aids. So, pwede po, inyo na po ito, ma'am. Ito po yung ating rotation site. Yan. Then, document evaluation of the learning process. The ability of the patient to correctly prepare and self-administer injection. So, that is self-insulin injection.